Hey everybody, Tim White, clinical specialist here with Aspen Rehab. We are here with Heidi, who is a patient of ours undergoing our treatment program for liposuction and contour irregularity. What Heidi had been dealing with is some lumps or knots after having a tummy tuck combined with liposuction. Actually, a number of years ago, correct me if I'm wrong, it was 13 years ago, you had actually had the procedure. Through channels of friends of hers, you had found out about our treatment program and were referred to us, and you are on your 5th of 5 treatments today, correct?
Yes,
Okay,
correct.
great. So Heidi was good enough to kind of do a little testimonial with us because, we like to present to our patients information of real patients, kind of their experience, so we can help other people understand that there is non-surgical options, why you want to avoid surgery, especially procedures such as liposuction and tummy tucks, which can create more problems or complications down the road. So Heidi, if you don't mind, kind of tell everybody what you were experiencing, like what in the tummy area was the problem.
I was experiencing a lot of tightness, the lumps, obviously. It happens, after a procedure that's done so long ago, you gain weight, so you still have the pockets, so it gets lumpy and it gets hard.
Right.
So it was uncomfortable to a certain extent because you feel really, really tight.
Right.
But definitely with the procedure, with the treatments, have really, really loosened all of that up, and it's been helping.
Excellent. And you had almost like a diagonal area. There were two pronounced, rounded, hard, lumpy areas above your belly button that
Yes.
were the most bothersome. And in your case, you had even noted that the scar tissue had become so firm and so adherent that you couldn't feel those areas. It was
No.
insensitive to being touched.
Yeah.
And when you did touch them or push on them, they probably were painful if you pinched them or poked them and things. Is that correct? Yeah. Okay. We see this very common after surgery with patients, any procedure really. Good surgeons do great procedures on great patients, and post-operatively things change. And in your case, typically what happens is inflammation, pooling of fluid, blood supply, patients who have autoimmune disorders, if they have infections, hematomas, seromas, or any of the trigger complicating factors, it increases the risk to have things like you, which is hard lumps or knots, or what we call lumpy and bumpy. Clinically, surgeons use the term contour irregularity. The good news is there's a treatment for it. And for the same reason why you don't want to do surgery to fix this, you want to try something non-surgical, that's what our program offers.
That's great.
So today is treatment number 5 out of 5. Today's your last treatment. You're almost completely there. In the 4 sessions you've had so far, what kind of progress have you seen? How much better are you? What have been your things that you've
Definitely
noted?
the sensitivity has came back. I'm not 100%, but definitely 70% to where I can feel, and it's a lot more loose. You can actually poke through and feel the soft tissue.
Okay.
Definitely like the follow through.
Feels like a tummy.
Yeah, with the follow through with the massages that the therapist told me, rub it at home.
Yes.
Yes.
We incorporate technology, we incorporate manual skills. So one of the important things that you mentioned is the patient is responsible for helping out as well. So not only do you come here and get treatment, but we actually show you things at home to do. And I knew you were 100% compliant with it. So, Heidi came here, she received the treatment, and then went home. She kind of had a home program to do. And that was really the key in getting better, is it's really a force relationship of you do yours, we do ours,
Right.
and you get better. Because we want you to look and feel better. And the good news is I remember even after your first session, in the very first treatment, you saw an immediate result.
Yes.
We felt it before, we felt it after. You knew that there was softening, and then progressively you got better, because not only do we want you to feel better, we want you to look better, right? Because you had a tummy tuck and liposuction to look and feel better about yourself.
Absolutely.
But then these things happen, and maybe now you don't want to be on the beach in a bikini because
I did it.
now I have these 2 lumps here or irregularities. So now you're not only feeling better, but you're looking better. You don't notice those contours and those bumps as pronounced as before, right?
Absolutely.
Okay, excellent.
And even when I'm sitting, before it was like super hard. Now I can actually like press into it and like, okay, well, I don't
Right.
feel it anymore.
Yes.
Before I would actually feel the lump there.
Right.
So definitely happy with it.
And we're happy you're happy. And the moral of this story is 13 years later, there's still help for it. So patients ask me all the time, they say, Tim, it just happened, or, I've had this for 15 years. Is treatment still effective? Can I get better? Can I do this treatment now? And the answer is yes. Heidi is the exact example of that. It's never too late, but best results are always achieved when we start early.
Yes.
So had you known about us earlier on,
Definitely.
we could have started earlier. And that brings another point. We have a after surgery program. So had Heidi known about us, had she known getting a tummy tuck or a liposuction, or even our most well-known program for breast implant issues, had she known about that, you could have started our post-op program, which means at 2 weeks after your procedure, you come in, there's a certain number of treatments, massages, lymphatic drainage, use of different technologies to help decrease the inflammation and the adhesions that actually cause what you had. So we can treat on both sides. We can treat an existing problem, or we can see you right after surgery to prevent the problem from happening.
Absolutely.
All right. Anything else you'd like to share with women out there, or men too, who have had either tummy tucks or liposuction on your experience?
I definitely recommend it. Everybody should try it. Follow the procedures that they tell you after surgery. It's very important. I was a little bit not organized with it, didn't follow how I was supposed to, so that's why I'm here. But this has definitely helped and completely recommend it.
Awesome. Well, Heidi, thank you very much. You look great. We're going to be doing Heidi's last treatment today, an evaluation. We will be showing some before and after photos of the treatment area so everybody can kind of see what that is. Is it okay if there are patients out there right now who've had a tummy tuck or liposuction, if maybe we share your email or your phone number with them, that they can maybe give you a call?
Absolutely.
All right. Awesome. Thank you so
problem.
much. Anybody with questions, feel free to give us a call. You can consult with us, phone or email. You can give us a call here at 954-341-7875, or you can take a look at the banner for our phone number. Don't forget to add us on our social media pages. They should be in the link and down below. And don't forget to subscribe to our YouTube channel. Thanks, Heidi.
Thank you.